Good morning to all of you. What a gorgeous day and an exciting day for us here at Columbus Regional Healthcare System and here at the Medical Center to officially open the new Emergency and Trauma Center. We've got a great morning, we think, planned for you. There are seats up available here for those of you standing in the back if you'd like to take advantage of those, but they're relatively safe, so feel free to come on up. But we're going to introduce a few folks. There'll be several folks making a few comments about the importance of this day. But before we begin, if you would, for those who are seated, please stand for just a moment as we honor our country and recognize our flag as the Honor Guard of Columbus Regional Healthcare System posts the flag of our great nation. I want to thank Sergeant Spicer. Please have a seat. Sergeant Spicer and Jeff Brown, the color guard of Columbus Regional Healthcare System, always adds a very nice and obviously patriotic touch to our programs. Again, thank you for coming. A truly exciting day that we've anticipated for actually years in planning an emergency center like this, but construction over about 16 months of truly tireless efforts from a great number of people. And I want to take a minute and recognize some of those, the folks that are involved in the design, the construction, those on our staff who are involved in shepherding this to where it is today. I want to start out by recognizing someone that has not been recognized enough in the process. I don't quite see him in the audience, but if Brian Laverty is around, Brian is there. It's Brian. Brian is in the back. Brian he's hiding. Brian started working on designs and concepts for emergency centers several years ago, and we've gone through several of those. And while Brian got focused on other projects, when this one finally came along, this vision here, certainly I know he takes a lot of personal pride in. And Brian, I want to recognize and thank your achievements and your contributions to getting us here today. I want to recognize Don Elder. Don is the Senior Vice President that shepherded the project through. Supporting him, Steve Goolsby. Steve is our in-house architect, and I'm going to quit looking around trying to find people. Steve's over here. They're all spread out, so they're not grouped together. But Steve is our architect. He was the project manager from Columbus Regional, again, engaging our great clinical team, our physicians, and the other staff who are involved. Many of them are here to my left, and I'll introduce a few of our staff here who led this project from a clinical and a design project as well, process as well, just in a moment. Our great contractors, Robbins & Morton. Robin Savage is going to come up, Chief Operating Officer of Robbins & Morton, and help us with the ribbon cutting, but also supported Donnie Williams here, Tommy Booker, our project on-site manager, and several other of the great Robbins & Morton team. We thank you very much for getting us here ahead of schedule and under budget. Can't complain too much about that. Great contractors, so thank you for that. And our design team from Perkins & Will, they led the architectural efforts. John Hogshead is here. Larry Witkowski as well. Larry, thank you for being here. We'll have them come up as well, help us officially cut the ribbon. I want to acknowledge our Chairman and Chief Executive Officer, Larry Sanders, our Chief Nursing Executive, Deborah Hernandez, sitting here in the front, and again, many others of our team spread across the audience and the crowd who certainly are part of this wonderful Columbus Regional Healthcare System, and we appreciate you all being here helping us celebrate this day. We officially welcome our first patients to the center tomorrow morning at 7 a.m., but we want to invite you to take the opportunity as we conclude the formal part of the program to take a preview, if you will, We hope that you or your family never have need for these services, but we want you to be well aware of the state-of-the-art physical space, the clinical and technical expertise that we have, and the great people that are part of this wonderful emergency and trauma center team. You've each got a program there with you, and we're going to follow that program pretty much to a T. We're going to I'm not going to come back and introduce each of the speakers, but instead I'm going to introduce each of them here at this point. They'll come up then in their turn and make their comments. We're going to start with our outstanding medical director of the Emergency Center, Dr. Drew Williams. Dr. Williams has 25 years or more of experience here with Columbus Regional Healthcare System and has done a wonderful job in helping create this vision and bring us here to where we are today. The next speaker will talk about trauma and the importance of trauma and having a trauma center available in our community, and that is our outstanding medical director for our trauma service, Dr. Scott Haney, who also serves as the chief of staff at the medical center and also is one of our surgical intensivist team members, leads the surgical intensive care team. Following Dr. Haney will be Michelle Wallace. Michelle is the administrative and nursing leader for the Emergency and Trauma Center, has been at the center of leading not only the design here, but getting us to the process that you will see that is very patient-centric, patient-focused. And she's going to also introduce Jose Velazquez, one of our former patients, and his wife Cynthia, who will come up and give you a little personal story to give you a window into the importance of having facilities like this available. We'll follow that with what I think you'll find an inspirational musical selection, and that will be concluded with a prayer of dedication by Reverend Mike Stewart. I'll then come up, make a few closing comments, and then we'll pose for the official cutting of the ribbon, and then we'll come back and give you a few instructions about the tours, the refreshments that we have prepared for you, and so on. So that's kind of how we have things laid out. So if you would help me join each of the speakers as they come, welcome each of the speakers as they come to the podium, starting with Dr. Drew Williams.
Thank you, and thank you to everyone who's come here today. I couldn't have asked for a more beautiful day to move into a more beautiful building. I want to thank again Mr. Sanders, Mr. Duke, Mr. Elder, and Steve Goolsby, obviously, for all the work they've done in this fine architectural group. I spoke this morning, I spoke a couple of days ago about a few things, and I wanted to kind of share some of my thoughts about this. When we're in emergency medicine and you're trying to build a new building, and you're moving from an old to a new, there's an emotion of the old and there's a joy of the new. But I can tell you in emergency medicine, the thing that makes it unique, and I think that was the dilemma that we confronted the entire time that we were doing this, is that in emergency medicine you deal with everything. You deal with anybody, anytime, anywhere. There's no way to really call out and say, well, we don't really do that, because we do. So if you've ever designed a new home or moved in or tried to rearrange furniture and had a whole bunch of people try to do it, you can understand the dilemma that we faced in trying to build this new facility. It moves us into a new era of healthcare. We're no longer going to have open bays. We're going to have private rooms. It's going to have no longer just one main nursing station, but it's going to have several nurses stations in order to provide more immediate care. There's going to be specialized areas for trauma, for OB, for behavior, for decontamination. We're going to expand after this into the old ER and make it even larger, so we'll have areas for off-stage time for the nurses to have a lounge, for the physicians to have a lounge, to have office and administrative space. It's going to be a great new facility, and I'm excited for it. The other day when I spoke, I used an analogy, and I'll try to use this again, and it may seem corny, but it was a dilemma that we faced every day of what do you do to get everybody in one space all the time, because so much of what we're putting in here just inherently doesn't go together, and I call it the dilemma of Noah's Ark. And that sounds, as a child I used to say, well, how do you build an ark and get everything on it? How do you keep the hyenas from eating the baby sheep? How do you keep the python away from the pigs? And as I was doing this the whole time, that's all I could think of. We're building an ark. It's an ark to bring people into, to hopefully save them, to hopefully help them, to hopefully end some of the despair, to be a facility that anyone can come to and feel a part of and not feel any sort of discrimination. We take everybody because we care and love everybody. I think that's why we've all gone into emergency medicine. As you go around, think of the dilemmas that we did face. How do you get a facility where you have someone with a high temperature next to someone with a low temperature, and yet you have to correct both of those temperatures? How do you get a prisoner on one end who's angry at the world and at the same time build a space to have a child who's innocent and just wants to come and get treated without being influenced? How do you go and have an area that someone who's on chemotherapy that can't be subjected to any sort of infectious disease is also in a space where it's filled with people who have infectious diseases? How do you provide a space where children and loved ones may be grieving because they've lost a child, and at the same time have a space where others are delighted because their children have lived? Too many times we see a trauma that will occur and two people have collided. One person has been injured and another perhaps not. The families are angered at each other. There's a lot of emotion. How do you design that space? Well, we sat down day after day and reworked it and redeveloped it and looked at this and looked at the old facility and basically tried to overcome Noah's dilemma. And I believe there was divine intervention. We went to Mike most of the time and I said, I don't know much about qubits, but I do know what we need. And I want y'all, when you go around the place today, to take a look at what's been developed, to see how we've worked this so that people are in places where they're comfortable to be taken care of. I think you'll find that it's a very remarkable facility. I want to thank everybody who gave us this facility. This is truly a gift to us as physicians, but also to the community. I think that's a signal for me to get off. I'm going to turn this over to Dr. Scott Haney.
As usual, I'm left trying to top Dr. Williams, which is definitely a hard act to follow. With trauma being the leading cause of death between ages 1 and 44, we needed to have a facility where we could rapidly, quickly, carefully, and efficiently care for the acutely cared patients in our area. We are a level 2 trauma center here. This facility, again with the visions of Mr. Sanders, Mr. Elder, Mr. Duke, and the Columbus Regional Board, gives us a state-of-the-art, top-flight facility to take care of these patients and provide them the greatest opportunity for survival and well-being. You know, for each patient that dies in a trauma, 3 are disabled, often permanently. And these are folks that are just starting out in life, starting families, starting jobs, starting careers. And trauma takes all that away from them. And we have a tremendous catchment area. We're the only, we're the oasis in the desert of trauma care, as you were, between here and Macon and Atlanta, Birmingham, Montgomery, south to Thomasville. We're it. We take all comers. Very nice new helipad out there. I'm sure it's going to get a lot of use. Again, so now this facility gives us a great place to manage these patients. I mean, words can't express how pleased I am with when you guys come back to see the way the trauma room looks, is that the facilities that we have here. We were all disappointed when Amendment 2 didn't pass and the reliable trauma funding wasn't available. But those patients are going to come here anyway, and we have to have a nice, great place to take care of them, and we do. And the fact that Amendment 2 did carry Muskogee County shows that the voters here recognize the importance of having a trauma center in their community and what it can do for them. We all drive on the same roads. My wife and kids are out there on the same roads that you guys are. Trauma can affect and can hurt anybody. So again, this is a great facility. It is state-of-the-art. I will hold it up against any other trauma bay in the state of Georgia, and I think it's really top flight. And again, this is the sort of stuff that Dr. Williams described it as a gift to you guys, a gift to the citizenry of Columbus. And I agree with that. Columbus, the citizenry, you guys out there, they deserve something like this. And by golly, today you got it. Thank you very much.
Good afternoon. I'm so excited that y'all are here today and just so pleased to be able to tell you a little bit more about what the patients and families are going to see when they come to the new Emergency and Trauma Center. You've heard about the building, about our special patients, you've heard about trauma, but what is going to be different if for some reason you or your family member has to come to the new ETC? When you get a chance to walk through, you'll look through the building and you'll see it's very warm. The colors are inviting. It does not look like a hospital emergency room or waiting room at all. We've heard that quote time and time again. Patients will enter into a reception area where they'll actually be able to be physically screened by a licensed nurse. Families will go back, or patients will go back through evidence-based process, through best practice research. When we designed this new facility, we did not design it because we just wanted it to look pretty. We designed it off of what some of the best hospitals in this nation were doing to provide fast, rapid, quality care for their patients and their families. You'll notice it is very patient and family focused. In the South, you never just get no family members or one family member. We usually get 5, 6, 7, 8, 9, 10. It depends, even more than that some days. But we notice that it has to be family too. Part of nursing and what we do is involving family in the process. For physicians, it's involving family as historians and being able to provide holistic care to our patients, and that is very important. So you'll see that, and you go in a room, you'll see there's a provider side and there's a family side. As nurses, we were very frustrated with always having to move family out of the way. We want them right next to their patient, to their family member, to be able to provide that care. You'll see some new things like results lounges for patients who may not need to stay in a room for a long period of time. They can actually be moved to a comfortable waiting area to wait for their results. You'll see in our shock trauma, there's actually 6 bays that 2 of them are dedicated to pediatric critical care. There's the first in the community to be able to do that, to dedicate resources to life-saving treatment for our pediatric population. You'll notice that there's a CT scan right next to the trauma room. For stroke and trauma, 100% of our stroke and trauma patients receive CAT scans. It's less than 30 feet away, a life-saving diagnostic treatment for our patients. It is just monumental for Columbus and for the region. And I could not go without talking about Region 7 Public Safety. And I see all of y'all out there, and we're so thankful that you're here today. But they are our partners. And they work with us every single day. They designed the helipad. They helped us design the ambulance entrance. They have a whole workroom back there. They helped us in this process because they bring the sickest patients in this facility are brought in by our public safety. So just very, very pleased. I can't go without talking about the nursing staff. All y'all over there. Thank you. Steve Goolsby and then the facility. And I'm sorry, I'm going to crack. It's been an emotional day. Just a great ability, just privilege to be able to work and to know that everything that we said as a nursing and physician partnership that we needed for our patients and their families, the facility said, yes, we need to do that. And a great example of trauma, we have Mr. Jose Velasquez who's going to come up and speak to you. But in December of 2008, his life completely changed. And I'm not going to say anything more, but I think you just need to hear his story. Thank you, Jose.
My name is Jose Velasquez, and I was a junior at Auburn University studying electrical engineering when, as a result of a car accident not too far away from here, I was brought back here to. I was brought back over here and was taken care of by Dr. Haney and his staff. I was in a state of coma for 2 weeks, and then in the hospital for 3 months, and it's been a very hard rehabilitation period. And even though it's been 2 years, I'm still struggling with the lingering brain injury that I suffered. So that's probably why I have difficulty speaking or putting my thoughts together. But nevertheless, I've gone back to Auburn University, and I'm still seeking my electrical engineering degree. And if it wasn't for Dr. Haney and his staff and the medical center, I wouldn't be here talking to you. And I am so grateful that I was given the opportunity to keep on doing whatever I was doing before. If it wasn't for the medical center, I wouldn't be here talking to you guys. So thanks a lot. Thanks.
Should I feel discouraged? Why should the shadows come? Why should my heart feel lonely and long for heaven and home? When Jesus is my portion, a constant friend is He. His eye is on the sparrow, and I know He watches over me. His eye is on the sparrow, and I know He watches me. I sing because I'm happy. I sing because I'm free. His eye is on the sparrow, and I know He watches over me. His eye is on the sparrow, and I know He watches. I know He watches. I know He watches me. I sing because I'm happy. I sing because I'm free. His eye is on the sparrow, and I know He watches me. His eye is on the sparrow, and I know He watches me. I know He watches me.
Thank you for the beautiful song. It is now time for our prayer of dedication. I ask you to bow your heads as I pray. Most Heavenly Father, we are overjoyed and blessed to be here today. We thank you for this new emergency and trauma center. Thank you for the vision and the countless hours of intense planning and work and labor that have been poured into this blessed place. Thank you for the gifts and skills of so many that bring us to this exciting day. As we open this beautiful place, may you use it to bring healing and comfort to the sick and to the injured, to the victimized. May this be a beacon of hope, of rescue, and refreshment to all who come seeking help. Bless and grant wisdom to the doctors, the nurses, and all the staff who will serve the community here. Grant them the grace to fill the patients and families who come here with hope, confidence, and courage. Give wisdom to diagnose each case correctly and to prescribe the necessary remedy to heal the body and ease its pain. We now dedicate this emergency and trauma center and seek your hand of blessing as the great physician upon it. In thy most holy name I pray. Amen.
I want to again thank Reverend Mike Stewart, the Director of Pastoral Care for Columbus Regional Healthcare System, for that wonderful prayer of dedication. I want to thank Bronte Robinson and Herbie Jack for the inspirational music. Pat Dixon was also on your program and unfortunately had an emergency that took her away today. But Bronte, that was really beautiful. And Herbie, thank you for the accompaniment. Again, a sincere thank you to all of you for joining us here today. It's about time to allow you to see what we're all excited about here and what we've been talking so excitedly and passionately about over the last few minutes. We're going to have some folks come up now and cut the ribbon, and as soon as we conclude that, we'll have opportunities for tours. There are refreshments over to my right, so staff members will be very happy, and there's a tour schedule, so about every 15 minutes or so we'll have folks available to come back and continue the tour in small enough groups so that you can hear about and see the facility. So again, thank you for being here, and for those who are participating in the official ribbon cutting, if you would come up now to the front, and we will conduct that formal ceremony.